Hello, my name is Claire. I'm going to be performing my intramuscular and subcutaneous checkoffs today. So the very first thing that I'm going to do is I'm going to go into the med room and I'm going to sanitize my hands and I'm going to check the healthcare provider order for the orders. I'm going to check my chart and I'm going to see here, I have my paper chart here, that my patient's name is Anna Powolowski. Her date of birth is May 5th, 1957. She has an allergy to penicillin and her reaction to that allergy is hives. I see here that there are two orders, one for an intramuscular injection and one for a subcutaneous injection. Her intramuscular injection is her influenza vaccine, which she should be getting once a year, and her subcutaneous is her B12 injection, which she gets once a month. So the very first thing that I'm going to do now is I'm going to pull my medications from the Pyxis. So I'm going to pull my B12 and my influenza vaccine. I'm going to check both of these vials for any particulates and to make sure that they are within the expiration date. And for the influenza vaccine, because it is a live vaccine, I need to agitate it a little bit. And I'm going to do that for about 5 seconds just to mix it all in there. And the influenza vaccine is a single-use vial, so I would not need to put my date, initials, and time on there. But if it was a multi-use vial, I would put my date, initials, and time on there. But since this is a single-use, I'm going to use it and then discard it. And for the B12, I already checked the expiration date, and I would make sure that my initials, date, and time are on this vial if I was opening it for the first time, or I would check and make sure that somebody else's initials, date, and time are on there, and add my date and time on there as well for the next use. So now that I have pulled my medication, I'm going to do my first set of writes. So I'm going to check and see against my vial here that this is for Anna Powolowski. She has an influenza vaccine, which is going to be given at 0.5 ml. So the route is to be intramuscular. The amount is for 0.5 ml for a single-use vial. The route is intramuscular and the time is now, which is going to be 14:20. And next I'm going to do my first set of writes with my B12. So this is for Anna Powolowski, person, date of birth May 5th, 1957. She has an allergy to penicillin, which her reaction is hives. The amount is 500 micrograms, but the concentration of the B12 is 1,000 micrograms. So I would give her 0.5 ml to half that amount to the desired dose, which is 500 micrograms. So I would give her 0.5 ml. The subcutaneous route and the time would be now, which is 16:20. So now that I've performed my first set of writes, I am going to let you know that I know what the anatomical positions and landmarks are for the IM and Subcu injections. So there are 3 IM and there are 3 Subcu. So I'm going to start with the IM. The first one is going to be your deltoid muscle, which is your upper arm right here. You're going to feel 2 or 3 finger widths down from the acromion process, and it should be across from the axillary line. And there is an imaginary triangle that you would inject straight into here, right in the middle, to avoid the brachial vessels and the radial nerve. The second place is going to be your ventral gluteal muscle, which I can't show you on myself because I would need to do it to an opposing person, but I would be going to the patient's left hip and I would place the heel of my hand on her greater trochanter, his or her greater trochanter, and I would point my thumb towards the groin. I would put my pointer finger up to the superior iliac spine, and I would make a V with my fingers, and right in between this V on the patient's ventral gluteal is where I would give my injection. And I would want to make sure that I would use my non-dominant hand for that V, so that way I am not I'm going to have more control with my dominant hand to get right in the middle of that V. And then the third place is going to be on the thigh. So it's 1 hand's breadth away from the popliteal and 1 hand's breadth from the greater trochanter, and it's going to be from midline to the lateral midline. So anywhere on the outer thigh, which I will stand up and show you. So it's going to be anywhere in this general region right here. And that's for the third place for the IM injection. For the Subcu, let me scoot in. For the subcutaneous injection, there are 3 sites as well. The first site is going to be the posterior aspects of the arm and the fatty bits back here. The second is going to be the abdomen, and it's going to be anywhere as long as it's 2 inches away from the umbilicus, and it's going to be below the costal margins, which mine are up here, and above the iliac crest. So anywhere in this general area, avoiding that 2-inch mark from the umbilicus. Where there is subcutaneous fat is where it's okay to give an injection, and the anterior aspects of the thigh is the third place for the subcutaneous injection. So now that I have done that, I am going to go ahead now and withdraw my medication. So I'm going to be moving my iPad down so you can see what I am doing. Okay, so I have my two vials here, and the very first thing I'm going to do is I'm going to take an alcohol pad and clean the center of the rubber stopper of each of these, and I'm going to make sure that I do this for about 5 to 10 seconds, so that way it is very, very clean. And I'm going to leave the alcohol pad there, so that way I know that I cleaned it. And I would do the same thing with this one here. And now I would go ahead and sanitize my hands one more time. For this one, I'm actually going to do it. And I would gather all of the rest of my supplies. So I am going to be using a 22 gauge 1-inch needle for my intramuscular injection. And I'm going to be using a 5/8 inch 25 gauge needle for my subcutaneous injection. Now normally these would be in the sterile packaging, but for our purposes, I'm going to open up our packages both here. And if these were brand new syringes, I would want to take them out and I would want to play with the plunger a little bit just to loosen it up. So I'm going to start with my intramuscular needle and my injection. So I'm going to go ahead and withdraw back to 0.5 mLs. And I'm going to then remove the alcohol pad from the influenza vaccine. I'm going to open my needle like a rainbow. I'm going to inject in the middle of the rubber stopper and inject air to air. Now I'm going to invert. And I'm going to withdraw 0.5 mLs. I'm doing this as close to eye level as I can so you can still see. Okay, and now I'm going to withdraw my needle and I'm going to passively recap. I don't know if you can see that. And now I would make sure that I label my syringe with my initials, date and time, the patient's name, and the medication and dose. Now I'm going to move the influenza vaccine out of the way, and I'm going to do the same thing with the B12. So I'm going to open up my packaging again. I'm going to withdraw 0.5 mLs of air. I'm going to open my needle. Going to inject in the middle of the rubber stopper. Inject air to air. Invert and withdraw. And on the first syringe, I did not have any air bubbles, but this one I do have an air bubble. So I would just withdraw a little bit more than needed so that way I can get rid of that air bubble. At 0.5, I'm going to do a little bit more. Okay, there are currently no air bubbles. So I'm going to reverse and withdraw, and I'm going to passively recap my needle. And I would also label this syringe with the patient's name, my initials, date and time, and the medication and dose. So this again is the subcutaneous injection, and this one is the intramuscular injection. Now, since I am going to be going back to the patient's room, I'm going to go ahead and put these back in their packages just to bring them with me. And now I'm going to perform my second set of rites. So I'm going to verify that this is for Anna Powolowski. Her date of birth is May 5th, 1957. She has an allergy to penicillin, and her reaction is hives. And for the first one, this is her B12 injection, and I could tell that from the label. This is her B12 injection. It is 500 micrograms for the dose. The route is subcutaneous, and the time is 16:20. And I'm going to do that same thing with the influenza vaccine. So this is for Anna Powolowski, the person, May 5th, 1957, penicillin reaction reaction is hives to that allergy. This is the influenza vaccine. It is for 0.5 mLs, and it's going to be given at a route of intramuscular, and the time is going to be 16:20. And now I would take both of my syringes and verify that they are the correct dosages. So that one is 0.5 mLs. And this one is also 0.5 mLs. So now I'm ready to go into my patient's room. So I'm going to gather both of my injections, my alcohol pads. I have some 2x2 gauze, which I'm just going to open up here, but I wouldn't open it until I get into the patient's room, just so it's out of the way. I'm going to grab my hand sanitizer, my sharps container that I'm going to put my needles in, and my gloves. So now I'm ready to knock on the door. Hello, Anna. My name is Claire. I'm going to be your student nurse today. And I would go ahead and I would sanitize my hands. I would say, Anna, could you please verify your name and your date of birth for me, please? And she would tell me that her name is Anna Powolowski. Her date of birth is May 5th, 1957. I would say, great. Anna, do you have any allergies? And she would say, yes, I have an allergy to penicillin. And I would ask her what her reaction is, and she would say that she has hives. And I would let her know that, Anna, I'm here to give you 2 injections today. I'm here to give you your monthly B12 injection, which you should be getting once a month. And I'm also here to give you your influenza vaccine, which is given once a year. Do you have an allergy to eggs? I would ask her, and she would say no. And I would say, because people who get the influenza vaccine are sensitive. If they're sensitive to eggs, they may have a reaction to the influenza vaccine. I would ask her if she has had a reaction to either of these medications before, and she would say no. And I would let her know that some of the common side effects of these medications would be irritation around the injection site, where there would maybe redness, some itching, a little bit of swelling, anything of that nature. And if there is any of that discomfort, to let me know, and I'll bring her a warm compress, and to make sure that she doesn't actually massage the sites or anything like that. And then I would ask her if she has any questions for me, and I would answer any of her questions. And I would make sure that everything is safe while I'm speaking with her, making sure that her bed breaks are locked, there's no trash on the floor, there's no tripping hazards, anything like that. And then I would go ahead, before I give her the injections, I would perform my third set of rites. So I would go ahead and verify with my subcutaneous injection that this is for Anna Powolowski, date of birth May 5th, 1957. She has an allergy to penicillin, and her reaction is hives. This is going to be a B12 subcutaneous injection with an amount of 500 micrograms at 0.5 mLs, and the route would be subcutaneous, and the time would be 16:20, which is right now. And I would go ahead and perform my third set of rites with this medication. So this is the influenza vaccine for the person, Anna Powolowski, date of birth May 5th, 1957. Her allergy is penicillin, and her reaction is hives. Is to be given at 0.5 mLs for the amount. The route is intramuscular, and the time would be 16:20, which is right now. So then I would go ahead and let her know that I need her to sit up on the side of the bed and relax her arm as much as possible. I would ask her which one is her dominant and non-dominant, because I want to give it in her non-dominant hand to prevent any extra soreness or irritation. And so she would say that she is left-handed, so I would go ahead and give it in her right arm. So I'm going to go ahead and sanitize my hands one more time before I start, and I'm going to don my gloves. So we're going to pretend my skin here is Anna's arm. I'm going to see if I can bring it down just a little bit more. Okay, so now I'm going to take an alcohol pad and I'm going to clean from the inside to the out of the skin. I'm going to let that air dry for a few seconds. And we're pretending that this is her deltoid, so I'm going to give it right in this triangle right here. Okay. So I'm going to go ahead and take my influenza vaccine. After that has air dried, I am going to uncap my needle, and I'm going to turn it this way because it's easier for me. I'm going to use the Z-track formation where I pull the skin taut to one side. I'm going to shoot the medication in like a dart at a 90-degree angle. I'm going to slowly depress the plunger. And I'm going to stay here for about 5 to 10 seconds. And while I do that, I can grab my gauze to sop up any blood or put any pressure if she is bleeding. And I would put that right here so I can grab it right away. And I would withdraw my needle. And I would just put the gauze there. And then I would go ahead and passively recap my needle. And I would put it in the sharps container. I would ask her, Anna, are you feeling okay? I know that hurt, but are you feeling okay? She would say, yes, I'm fine. And I would go ahead and blot up any blood, and I would put a Band-Aid there if need be. And now we're going to pretend that she is going to be in Fowler's or semi-Fowler's position. So I'm going to have her put the head of the bed up and have her lay back a little bit so I can get to her abdomen where I'm going to do her subcutaneous injection. And once again, I'm going to take an alcohol pad and I'm going to clean from the inside to the outside of the skin of her abdomen. We'll let that dry for about 5 to 10 seconds. I'm going to remove my needle. And for this one, I'm not going to use the Z-track formation. I'm actually going to pinch. I'm going to pinch as best I can on this fake skin. But normally I would pinch an inch, and I would go right in the middle and shoot it down at a 90-degree angle, just like a dart, like the last one, and depress the plunger slowly. Now, if Anna were too skinny and I was not able to pinch an inch, I would go in at a 45-degree angle with this needle. And this one I can remove right away. I would remove and put some gauze there in case there was any bleeding, and I would passively recap my needle. Now I do recognize I had to grab my syringe with my hand, but that's because my fake skin likes to shoot water everywhere, so I had to do something about it real quick. So now that this injection has been completed, I would also apply pressure if there was any bleeding, and I would ask her if she was feeling okay, and I would apply a Band-Aid if need be. And now, since my sharps are in the sharps container and the lids are on, I would remove all of my garbage and remove my gloves. I would ask her if she's feeling okay, and I would stay with Anna for a little bit while I did my charting, and I documented that I gave both of these medications, and I would make sure that she doesn't have any of those adverse allergic reactions to the influenza vaccine. And I would go ahead, like I said, and clean up all of my mess. I would document that I gave the medication, and then I would put Anna back in a comfortable and safe position, and I would put the bed back down at its lowest position, and I would sanitize my hands as I was leaving, and I would let Anna know that I'm going to come back and I'm going to come and check on her in an hour. Thank you so much, and I hope everybody has a great week.